start us off. So, good morning. My name is Deborah Zeisman. I'm Executive Director of Hawaii Children's Action Network, and we are pleased to welcome you to the unveiling of the 9th annual Hawaii Children's Policy Agenda. Many of us on this call in the community, we started this process 9 years ago with the intention of bringing together the best and the brightest people and smart organizations in town who really could help pull together a research-based, evidence-based, sound policies to present to the legislature that are good for children and families. So that is what we have for you today. This is our 9th year. Some of the folks on the call have been with us from the beginning. We do a process kind of throughout the summer and into the fall of discussing issues, distilling them down, and then we choose what the community side thinks are the most important things. This year, we had more than almost 60 different people and organizations get involved, come to the table with different ideas from around the state. And we landed on 12 different priorities that we will present to you today. And the priorities do fall, we've kind of categorized them. Many things overlap, but we have categorized them into 4 different areas. So economic security and justice for families, preschool to grade 12 education, health, and child safety and wellness. So things, sometimes they do overlap and they hit more than one area because many things are intersectional, but we've tried our best to try to have some policy priorities that we then all come together and present to the legislature as what we feel, if we passed all of these measures, would really help to improve the quality of life, the health, the education of our children and youth. And Nicole is putting the agenda, I think, in the chat as well. And so we are going to go quickly in an order. So community folks and members of the media, our plan for the day right now is that each organization or coalition will relatively quickly present what their policy priority is. And if you have questions, we would ask that you either hold them to the end or put them in the chat. And then we will have some time at the end to moderate some Q&A. But just to let each of the groups kind of present what their idea is, what the bill numbers will be. And so with that, I will hand it over to Nicole Wu, who is going to kind of moderate the presentations.
Hi there. Good morning, everyone. Thank you so much for joining us, both media and community members. And I'm not sure if there are any legislators on, but I know we're all super busy at the start of legislative session. We're super excited about our agenda this year. We go through a process of a few months where community organizations come together and we settled on or voted on these 12 priorities for the year. Whoever's sharing screen, if you could scroll down. And yeah, and I was going to show the one pager, but if you want to click on the one pager, just to quickly show it. Or I can show it. I have it. Okay, let me. Sorry about that. Thank you. Just to let you guys see. Oh, okay, I lost it again. Sorry. So yeah, so this is the one pager, and we're going to be speaking basically in the order that the bills show up on the one pager or on the page that I put in the chat for you all to follow along. The only exception is our first speaker who needs to get back to class. So we'll let him speak first, but then we'll get back to the order of the bills on both the agenda and the one pager. And also I want to let the speakers know that if you need to share slides, you can share slides as well. So our first speaker is Luke Itomura. He's a student at Punahou, and he's a member of the Coalition for Tobacco-Free Hawaii Youth Council. And his bill is under Health and wellness for children. It's for ending the sale of all flavored tobacco products. So Luke, if you're here.
Hi. Hi, everyone. Thank you for the opportunity to be here today and present our policy priorities at the Hawaii Children's Policy Agenda. So I'll just do a quick introduction. I'm Luki Tamura, freshman at Puno School and State Youth Council leader with the Coalition for Tobacco-Free Hawaii Youth Council. So I'm just going to talk a little about the policy priorities that we have. So this 2024 legislative session, we're advocating for 4 different bills that work towards our top policy priority, which is eliminating the sale of flavored tobacco in Hawaii. So first, we have 2 companion bills, HB 1563 and SB 2304, which are the bills that would currently restore the county's authority to regulate tobacco sales. So this would allow the city and county of Honolulu and county of Hawaii flavor bans to become law. Second, we have HB 1778 and SB 2691, which are the bills that would end the sale of all flavored tobacco in Hawaii. Passing these bills are crucial because Hawaii must protect its keiki and fight back against the sneaky marketing tactics of big tobacco companies. These bills will act as barriers, preventing youth from being used by companies like Big Tobacco, who specifically target youth with their marketing in social media, TV shows, magazines, and stores. Tobacco companies strategically market flavors to youth to create lifetime customers. In fact, 1 in 3 Hawaii high school students regularly vape, with 97% of them using flavored tobacco products. As youth, we see this problem directly in schools, with teachers having to take time out of classes to give lectures and confiscate vapes, and even in school bathrooms having to be shut down because of the amount of people vaping there. And for us, it's very discouraging and depressing to see our peers fall into this pit of vaping, and their nicotine addiction makes them stop doing the things they love. And we slowly watch them become different people, no longer interested in the things they used to love, only interested in smoking. This 2024 legislative session, we hope to vastly improve Hawaii's public health by eliminating the sale of flavored tobacco. I also want to give a huge thank you to Senator Elefante, Senator Rhodes, and Representative Marayoshi for introducing these bills. Here's to many successes this legislative session. Thank you.
That's great, Luke. Thanks so much. I think about what I was doing when I was in high school, and it was not this. I'm super impressed, and thanks for coming out of class to join us. The next bill is paid family leave. So we're going to go back up to the top of the list. And I'm actually going to speak about that. If I could share screen. I'm representing the Paid Leave Hawaii Coalition. And so you can see it here. And so this is a group of lots of organizations that are on this call today, and a whole bunch of others. A lot of people think of paid leave as a children and women's issue, but actually we have a lot of kupuna groups involved and folks across the spectrum of life experiences, because we all will need paid leave at some time in our lives. So quickly, what is paid family leave? In a nutshell, it allows workers to take some time off and get paid when they need to care for themselves or for their loved ones when they're seriously ill, or to bond with a new child, a new baby, adopted child, something like that. So there's several different types of leave. You know, most of us think about the first one on the left, the green bonding one, when we have a new baby. But we also would like paid family leave into Hawaii to provide care, to allow workers to provide care for their loved ones when they have to take time off. So this means kupuna care, as well as, you know, if your spouse, God forbid, or another family member or loved one needs you to take care of them for a while, you would get some paid time off. Then there's active duty leave. A few states have some leave for times of deployment. And then on the right side, there's medical leave, and that's for your own serious illness. That's not like just having a cold, but something serious like, you know, recovering from surgery or, you know, cancer treatment. And then at the bottom, we have safe leave, and that's another type of leave that a few states have, where domestic violence survivors are able to take some paid time off and make arrangements so that they can keep themselves and their family safe. The United States is the only developed country in the world without paid family leave. All the way at the bottom on the right, you can see the United States has 0 weeks compared to the rest of the world. The average is 1 year in the OECD, which is this group of developed nations. So we're far behind. So to fill that gap, 13 states in the District of Columbia have decided to pass paid family leave laws. And we think it's time for Hawaii to join them. I'm not going to go through all of these, but in general, workers here do not have access to paid family leave. Only 1 in 4 private sector workers in Hawaii have that. We hear about things like FMLA and family leave law in Hawaii, but those are unpaid leave. And we do have some leave called temporary disability insurance for working mothers, but that's for them to physically recover from childbirth. So, you know, parents who didn't actually give birth don't qualify for any temporary disability insurance. So we've been expecting families to just cobble it together, to struggle, and also their employers to somehow cover their leaves. And we don't think anyone should have to make that choice. And tons of research, 20 years worth in one slide, finds that paid family leave helps children, helps their parents. These families are healthier, more economically secure, and they won't need public benefits as much. The business community, the business press has been learning that paid family leave is good for business. And that's because when family leave is provided to employees, they're more productive, they're more loyal, they're more stable. It also helps small businesses compete better with the larger businesses because right now small businesses can't afford to provide this kind of benefit package. So if we had a statewide program, that would actually help the little guys compete with the big guys. And similarly at the state level, if you remember the map that I showed, the entire West Coast has paid family leave now. So, you know, Hawaii needs to kind of like step up to the plate so that workers, you know, with who are thinking about having kids, for example, you know, would know that they could get some leave in Hawaii rather than maybe going to California, where for 20 years they've had this benefit for workers. So when we talk about paid family leave, it's a state-run benefit program like Social Security or Medicare. Little payroll deductions would come out, and then the workers apply to the fund when they need the leave. And the key part about that is that the employers no longer need to pay the workers while they're on the leave because the fund is paying them. And that allows the employers to hire some temps or otherwise cover the work. And of course, if the employer wants to top it off, be more generous, they can do that. But a paid family leave program provides a floor for these workers to get some pay when they have to take time off. We worked with the Commission on the Status of Women to have a study done. It was a few years ago, back in 2017, I believe, and it was 200 pages almost. So again, one slide. The study found it was totally feasible here in Hawaii, not going to cost a lot. And when workers were polled in opinion polls here in Hawaii, 94% liked the idea of having paid family leave here in Hawaii. So that's our page for the Paid Leave Hawaii Coalition. You can see the broad set of groups that are supporting this idea this year. And in the Hawaii Children's Policy Agenda page, it shows 5 paid family leave bills that we're looking at for this session. There's actually, last time I counted, 12 of them. So we identified the 5 that we think sort of summarize all the stuff that I mentioned in these slides. So that's
Nicole, you just muted yourself.
Oh, sorry, I clicked. So the next bill that's up is the Child Independent Care Tax Credit. And that's actually me as well. I'm representing Hawaii Children's Action Network Speaks instead of Paid Leave Hawaii for this bill. And basically, we all know that childcare is super expensive here in Hawaii. It's averaging over $13,000 a year. That's more than in-state full-time tuition at UH Manoa. So who knows how we are expecting working families with small children to make ends meet in Hawaii. So one way that we can, help families afford to live here and stay here in Hawaii is by helping them with their care expenses. And the Child Independent Care Tax Credit was created 40-something years ago for all different types of care expenses, childcare, but also if you have, a parent who needs adult, senior care, daycare, that kind of cost would be covered as well. The tax credit is a great idea. Kudos to Hawaii for having it, but 40-something years ago, childcare costs were a lot lower. Costs in general were. So the tax has sorely needed an update for decades. And last year, the legislature actually did do like half of the increase for the Child Independent Care Tax Credit. There are two caps. There's one for the amount of money you can claim in the credit, and there's another that's for the percent of your expenses that you can claim. The legislature raised the amount, but they haven't raised the percent yet. So we want to get the percent up. And that way, that allows families to get the full amount of the credit. On our Hawaii Children's Action Network Speaks page, there are details about the actual numbers in that proposal. So I'll put that link in the chat as well. The next person to speak is Deb Zeisman about the Child Care Worker Wage Supplement.
Hey, thank you, Nicole. The next priority area is from the Hawaii Early Childhood Advocacy Alliance, which is a large coalition, and HCAN Speaks is a member and currently one of the 3 chairs of this coalition. We are working to have equitable access to high quality, affordable childcare and early learning for all families across the state. This idea is a child care worker wage supplement. This is something we worked on last year that made it all the way up to the end in conference committee, but was not passed into law. So we're bringing it back this year. The idea is a wage supplement for those who work in early care and education. We know we have a workforce crisis. We have seen declines in the number of folks working in early care and education, even prior to the pandemic. And largely, this is believed nationwide to be an issue of low pay. So the concept for these 2 bills, HB 1964 and the companion Senate Bill 2603, are for taxpayer dollars to be pushed out to the different childcare providers, whether it's family childcare or center-based, like the group childcare, to help lift wages up at least over minimum wage, if not getting closer to a living wage, without needing to charge families more. So this is an idea that has been done in numerous other states and is a program that we have been doing in Hawaii during the COVID years using some federal dollars. Those federal dollars are now coming to a close in 2024. And so we are advocating that some state and different federal dollars go into continuing to supplement wages to not only stabilize the workforce and have less folks leave, but in order to meet many of our goals, the need for early care and education, we actually know we need to double the number of people who work in early care and learning. So we know if we want to attract more people into this career path, we need to make it a good job that folks can feed their families with, pay rent, all of those things. So there are 2 companion bills, and they are, I will note, part of the Women's Caucus package as well this year.
Thanks, Deb.
That's it.
We're
Thanks.
finally going to get away from HCAN Speaks people. Our next bill is the Child Tax Credit, or called the Keiki Credit, I've heard. We'll have Devin Thomas from the Hawaii Budget and Policy Center speak on that.
I'm going to share my, it says that I can't share my screen. But until that part gets sorted out. Hi, everyone. I'm Devin Thomas, Budget and a tax and budget policy analyst at Hawaii Appleseed, and I'm going to talk about the child tax credit today. So here we go. First off, want to note that it is not the same as the CDC-TC that Nicole talked about. This is a very common confusion. A lot of legislators have continued to think that they're the same, even after informing them that they are in fact different. So just want to remind folks of that. Why we need a child tax credit or a Keiki credit. Hawaii is incredibly expensive. We all know this. Child poverty has risen since the federal CTC expired in 2021. Local families are just struggling to make ends meet. This is not a surprise to anyone on this call, or it shouldn't be. So there's a federal child tax credit that was expanded temporarily, and it kept pretty much almost 3 million children across the US out of poverty, which is unprecedented for us. So we know that it works. We know that this is an effective policy that can be applied to Hawaii as well. And other states have done this at the state level to fill the gap. So you can see what happens going by the supplemental poverty measure when the CTC expansion ended, right? So the CTC, think of it as more of a cash payment than a tax credit. It's just money in a family's pocket that they can use to pay for all of their necessary expenses: housing, transportation, education, food, all of that, right? 14 other states have created their own state-level child tax credits to fill the gap left by the federal CTC expansion. And we hope to follow in their footsteps. This year, we have a great opportunity to create a state-level CTC for Hawaii. And going on to the details of this, a $650 credit for all, for every child, that is, under the age of 18. So this is for, household claiming children under tax filing. Phases out above $40,000 and up to a maximum limit of $115,000. The cost would be $84 million based on this structure, but we all know that this is an investment that reaps long-term benefits far beyond the initial investment. And if the human impact doesn't speak to you, if you're one of those economically minded folks, then be swayed by the fact that it massively boosts lifetime earnings, educational, health outcomes, everything across the board. So please get involved if you can. On the House side, we have HB 1662. On the Senate side, we have SB 2660. So please support if you can. Any help is appreciated. Thank you.
Great, thank you so much, Devin. The next bill on the list is removing the tuition cap for childcare subsidies. And we're just gonna say that that's in our children's policy agenda, but we're actually gonna pursue it through administrative rules. So there won't be a bill. So we can move to the next one, which is universal free school meals. That's Jordan Thomas, also from Hawaii Appleseed, to talk about that.
Thanks, Nicole.
Jordan's here. Yeah, hey, Jordan.
Hi, everyone. Good morning. Thanks for being here. I'm Jordan Smith with Hawaii Appleseed, Senior Policy Analyst for Anti-Hunger Initiatives. This marks the second year that our legislature is considering funding a universal free school meals program, which would offer up to 2 free nutritious meals to all students in a qualifying public school, regardless of their eligibility for the federal free school meals program. This is a stride towards equity, breaking down barriers, and improving access to school meals, especially for students from ALICE households. 2 out of 3 households in Hawaii struggling to make ends meet are ineligible for free school meals. Currently, a family of 4 in Hawaii needs to make less than $44,000 a year in order to qualify for the program. Universal free school meal programs dismantle systemic, economic, administrative, language, and social challenges to accessing school meals, ensuring that no child is left behind. After the end of the successful 2.5-year universal free school meals pilot implemented during the COVID-19 public health emergency, 8 states across the country have already passed universal free school meals legislation, recognizing their potential to invest in the well-being and future of their children. Dozens of other states are contemplating similar measures, and Hawaii has a unique opportunity to lead the charge in prioritizing the health and education of our keiki. Hawaii Appleseed's analysis estimates a universal free school meal program would cost approximately $25.5 million, or just 1% of the DOE's budget, for an incredible return on our investment. Mahalo to Representative Matayoshi and Senator Shimabukuro for introducing HB 1775 and SB 2327. You can learn more about universal free school meals, the extensive benefits to our keiki and communities, and more about our analysis in the policy brief link that I will put in the chat. So thank you so much.
Thank you, Jordan. Great to hear about that proposal. The next one on the list is credentialing requirements for school psychologists. And as you might imagine, the school psychologists working on this bill are working right now because it's a school day. So they couldn't send a representative to this. But just to read off of what's in the Children Policy Agenda Summary, Hawaii is the only state in the nation that does not regulate its school psychologists. As a result, individuals with inappropriate training can be hired into open school psychologist positions. Requiring credentialing for school psychologists guarantees that Hawaii's children, youth, families, and schools have access to effective and high-quality school psychological services that adhere to national standards of practice. They've been trying to get this bill passed for quite a few years. So if anyone in the press needs to contact or would like to learn more, just contact one of us at HCAN Speaks, and we can put you in touch with one of the school psychologists that's working to pass this bill. Next up is a bill about mental health awareness in schools. And to speak about that one, we have Judith Clark of Hawaii Youth Services Network. Judith?
Aloha, and thank you for giving me this opportunity to share youth voice about their needs. Each year we hold a Hawaii Children and Youth Summit at the state capitol. This year, and the youth come up with recommendations for legislative action. They then vote online to rank the recommendations in priority order. And this year, number 2 and 3 were both about mental health. According to the 2021 Surgeon General's Advisory on Youth Mental Health, recent national surveys of young people have shown alarming increases in the prevalence of certain mental health challenges. Locally, 35% of middle and high school youth in Hawaii experience persistent depression. 7% of high school and 11% of middle school students in Hawaii report having attempted suicide. 23% of middle school students report that their mental health was most of the time or always not good in the last 30 days. Youth mental health issues are a high risk for substance abuse use. TeenLink Hawaii has a website that gets 2,000 site visits on average per month. The top topics or pages visited included suicide, health and wellness toolkit, sleep, stress, mental health, and self-care. And finally, a Hawaii Department of Health report using 2020 data estimates that 11,000 of Hawaii's youth experienced at least one major depressive episode in the previous year. Of those who experienced this, approximately 6,000, or more than half, did not receive any mental health services. Our young people need and deserve mental health services in their schools and their communities, and we hope that you will support SB 2001. I'd also like to call your attention to 2 other mental health for youth related bills, SB 2460 and HB 2042 relating to mental health. These two bills allocate funds to the Department of Health for mental health and wellness programs for young people. Thank you for this opportunity to share this important issue with you.
Thanks so much, Judith. Definitely a very important topic for us to think about. The next bill in the list is about dental hygienists applying dental sealants in school-based settings. And talking about that is Mai Hall, representing the Hawaii Oral Health Coalition. Mai?
Aloha. My name is Mai Hall, and I am with the Hawaii Oral Health Coalition. Here to share with you a little bit about HB 1777 and SB 2476. Hawaii has the highest rate of dental cavities in the nation for school-age children. This bill would increase access to oral health care through school-based programs that provide dental sealants. Now, dental sealants are thin coatings painted on the back of the teeth, the molars, and it provides that protective shield which blocks germs and food and can prevent cavities. According to a Hawaii Smiles 2015 report, more than 60% of Hawaii children do not have protective sealants and recommends prevention programs such as school-based oral health programs. Children in Hawaii have the highest prevalence of tooth decay amongst third graders, and more than 70% of Hawaii third graders are affected by tooth decay compared to the national average of 52%. The Centers for Disease Control and Prevention and American Dental Association cite sealants as the most effective preventive strategy in tooth decay. This proposal would allow dental hygienists to apply those dental sealants in school-based oral health programs under general supervision, meaning that the dentist is not directly on site without a complete treatment plan or examination from the dentist. However, Hawaii also has some of the most severe restrictions on dental hygienists, which hinders the increased application of sealants in schools. These archaic professional boundaries prevent dental hygienists from being a powerful contributor in improving children's oral health. Improving access to care is dependent on allowing our workforce to provide the said care, and therefore these changes are critical. Oral health care and physical health care are no longer two distinct categories. The impact of poor oral health is felt for a person's lifetime. Hawaii must turn the tide of poor outcomes for children's oral health, and changing these key policies would allow for the expansion of a school-based oral health program, and as a result, promote healthier and happier keiki. Mahalo for allowing us to share this with you.
Thanks so much, Mai. And the next bill is about litigation abuse protection for survivors of domestic violence and sexual assault. And speaking about that is Angelina Mercado from the Hawaii State Coalition Against Domestic Violence. Hi, Angelina.
Hi, good morning. I'm Angie Mercado, Executive Director of the Hawaii State Coalition Against Domestic Violence, and we have several measures addressing abusive litigation. So this is actually the first time that there are bills being introduced to address abusive litigation as a standalone statute. For those of you who may not be familiar, abusive litigation is when a person uses the courts to harass a former intimate partner, their friends and family with multiple and frivolous legal claims to further harm and control that survivor. So that can look like filing unnecessary cases, motions, and appeals, trying to reopen and continue closed cases, filing in multiple courts at the same time, dragging out, delaying court hearings to harm a survivor financially or economically, and suing the survivor for reporting abuse, or suing to and threatening to sue anybody who helps that survivor. So what this bill does is for a domestic violence, sexual violence survivor or stalking survivor, they can claim abusive litigation in our courts. So it's not just in the family courts, it can be in our district courts and our circuit courts with somebody who has been found to be abusive in any one of those manners. And the judge will be able to assess if there's a pattern of abusive litigation. If so, if there's a history of abusive litigation, and if the litigation brought before that judge at that moment is abusive litigation, they can order an issue, they can order restricting abusive litigation. And what that will do is a couple of things. So most importantly, it'll impose pre-filing restrictions for a period of time. That does not restrict somebody from being able to use the court systems as appropriately. What it will just do is cause the courts to review what their filings are to determine and make sure that they're not abusive. And then in that particular case, the survivor will be awarded attorney's fees and costs of responding to the abusive litigation. They will also be compensated for lost work due to having to attend courts, transportation costs, and childcare that some of our advocates here have talked about is either inaccessible or extremely expensive. So we're grateful to the Women's Legislative Caucus and Rep. LaChica for introducing HB 1965 and the companion 2604, and also to Senator Rhodes for also introducing SB 2685 at the request of a constituent. Thank you.
Thanks so much, Angie. And the final bill today in the Children's Policy Agenda is keiki drowning prevention. And we'll have Jessamy Horner from the Hawaii Water Safety Coalition to talk about that bill.
Hi, thank you so much. And thank you all for your time with so many important issues under consideration. I'm the coordinator for the Hawaii Water Safety Coalition, and I'm also here as someone who has lost loved ones to drowning. I want to support the legislative solutions to the silent epidemic that we have in Hawaii. Drowning is the leading cause of death for keiki 1 to 17, and less than 2% of our second graders have the basic competencies to avoid or recover from a dangerous aquatic situation. The two bills proposed are critical. HB 2623 would fund in-school DOE aquatic safety lessons and an admin position. In-school lessons are the only way to provide these foundational life-saving skills to all of our children in Hawaii. After-school lessons are out of reach for most of our families. This is also a model that we're seeing used successfully in other states. Also, SB 2841 designates May 15th as Water Safety Day as a platform for outreach just before summer that we can all use to amplify this much needed messaging to our whole community. Thank you all again.
Thank you, Jessie. We're going to move on to the question and answer time. I'll let Courtney take that over.
Hi, everyone. I'm Courtney Velasquez, Deputy Director with HCAN Speaks. And thank you to all our presenters for sharing about the bills. We'd like to take it and open it for questions right now. So if you can please indicate with a raised hand or come off mute or put your question in chat. So this is, let's see, Ashley first. Ashley.
Hi, I wanted to see if anyone could clarify on the litigation measure. How do you tell the difference between, like what is legitimate litigation and what are some of the telltale signs that it's like how can you differentiate between the two?
Sure, I think that question is for me, right?
Yeah, I think so.
Yeah, since that's the only thing that comes close to it. So yeah, so I think, very similar to the way we have, domestic abuse and the way we define the domestic abuse, that it's a pattern. So one of the things that the judges will be looking for are things like patterns. And so, for instance, that's one of the one of the protections so that survivors don't get caught up in that abusive litigation themselves, where there be cases brought against them for legitimate reasons that they may be going to court. So one of the things that we see as cases or what we see hearing from survivors, and that shows up a lot, is especially when there are intimate partners who have children together. And so we will see survivors come through the court systems a lot when their former abusive partner and they have children together, and that partner wants to contest custody, or they want to rearrange custody, and they come back and forth and over and over and over again. And may have a particular feeling about whether or not they actually want to spend time with children, but the intent is that they want to bring that former partner to the court. They want to force them to have to see them and be, you know, in their presence, and then have to spend time with them, first of all, in that setting. But they know that every time they bring them to court, it costs them money, because these are civil actions, and then we usually require private attorneys, and that costs money. So every time you go to court and every time you pay an attorney to go to court, it costs you something. So that's some of the things that we'll see a lot of. It happens a lot in custody cases, when there are not children involved. What there could be a lot of issues of, where there may be assets shared. And so then there's property involved. So those are some of the situations that we'll see when they're former intimate partners that don't have children involved as well. You know, I can take up everybody else's time like on issues like this, but I know so many people have important policies that are critical to our community. But those are some of the key examples that judges will be looking for to see where have these former intimate partners, and that's a really like key designation, gone back and try to relitigate things, or constantly bringing the same partner to court over and over again, and that becomes frivolous.
Thank you.
Thank you, Angie. Other questions? Megan? Please.
Hey, sorry, I'm not sure if anyone can speak to this, but I was just wondering, for the bill about the licensing of school psychologists, is there a reason why the bill hasn't been successful in past years, or is there anything different about the bill this year that might, you know, increase its chances of passing in the legislature?
Or would you like to?
Could I speak to that a little bit?
Please
There
do.
actually, by the way, has been at least one hearing already this session on the licensing of school psychologists. I don't think there is a particular reason why it hasn't been successful in passing before, except that the School Psychologists Association have proposed that it be under the same licensing board as the clinical psychologists, and the clinical psychologists feel it should be a separate governing body or board. I also wanted to say that one reason that we are supporting the licensing of school psychologists is because in the aftermath of the Maui wildfire, there was a huge need for qualified mental health professionals to provide crisis intervention and counseling with the survivors and their families and others who were traumatized by it. But because American Red Cross and FEMA required those professionals to be licensed in order to have access to the survivors, the school psychologists, who are, you know, very well qualified to deal with the children's trauma, were not allowed into the shelters and the hotels where the survivors were staying.
Judah. Other questions? Wendy?
Aloha, everybody. I had a question specifically about the dental hygienists in schools, and am wanting to know if there has been any other approaches to the dental caries problem or concerns here in Hawaii, either through health education, other agencies, patient education, or perhaps any food bills that would support limiting sugars or access to sugar, as opposed to putting a dental hygienist in the schools.
You want me to
Go ahead,
take that?
Peggy.
Okay. So I think there's two parts of this question. One, the dental hygienists are already working in public school settings. A lot of them are connected with like community health centers. So that's already happening. We're not going out there and creating like a new program. We're just enabling those hygienists to be able to apply dental sealants in that first visit under the direct supervision of a dentist. To answer other parts of your questions, there are recently, 2 years ago, the adult dental Medicaid benefit was reinstated in Hawaii. That had been gone for a long time. So that was creating a huge gap in care. And food bills, we have been discussing sugar sweetened beverage fee. That's not up this legislative session. We're working on an educational campaign so people understand what that means and how that would impact health. And let's see, I think, and May could probably speak to more of the oral health work on this, but there's also an oral health task force bill to call together people in the oral health world to sort of discover, think about, discuss, identify different strategies that could be implemented to help oral health in the state. And I don't know, May, I know I'm missing something, but.
No, I think you pretty much got it. Does exist a program already in Hawaii public schools, Title I schools. What this bill aims to address is entering school to meet children where they are at. Because currently we hear from our federally qualified health centers and our Native Hawaiian healthcare centers who are in our high needs communities, and they say it is very hard for children to reach them, even though their insurance is accepted and they are Medicaid clients, and these centers are in the communities right across the street. Sometimes it's hard for parents to take off of work, take their child to a dental visit. The parent might not have paid leave. So there are actually a lot of things, and this is a very good question, a lot of companion accompanying bills could help reach more children this way. Paid family leave, the ending of tobacco flavors, because that also affects teeth. So and the nutrition in DOE schools, there are a number of things coming up that would help to expand access to oral health programs. So yes, it is that holistic perspective that we're looking at, but for this bill specifically, it is to specifically to allow dental hygienists that practice to work within their scope of practice because they are already trained to apply dental sealants. It is a cost-saving measure to allow this program in existence in schools to continue the work they're doing at a lesser cost so they can reach more children.
Thank you, Peggy and I. Any additional questions? Seeing and hearing none, I will turn it over to Deb to close us out.
I would just say thank you then. Thank you all for coming to the unveiling of our 9th annual Hawaii Children's Policy Agenda. For those of you who did join late, we have been recording and we will share out the recording to everyone who's been on this call later today. We'll be posting it onto YouTube because that's the easiest for viewing. If you do have any other questions, please reach out to any of the folks on the call today or to myself, and we can connect you with the organizations and coalitions that are leading these measures if you're interested in getting more involved as we begin the 2024 legislative session. So I think that's it. We'll keep folks in the loop, and we do hope that all of these measures make it across the finish line and onto the governor's desk this year. So thank you all.